First, let's talk about some facts regarding attention deficit hyperactivity disorder or ADHD. ADHD is the most prevalent childhood psychiatric disorder in Canada. ADHD is the most treatable psychiatric disorder in Canada, but it is still widely under-recognized and underdiagnosed. Children with ADHD are frequently labeled as problem children rather than children with a medical problem. 80% of children maintain their diagnosis into adolescence, and at least 60% remain impaired by symptoms in adulthood. Diets that limit food additives and sugar will not cure ADHD. Treatment for ADHD should always include a variety of modes. There are 3 presentations of ADHD depending on which of the 3 core symptoms are present. These include predominantly inattentive, previously referred to as ADD, predominantly hyperactive, and combined inattentive and hyperactive, which is the most prevalent. Although ADHD medications do not cure ADHD, they can help improve the functioning of children and adolescents diagnosed with ADHD. Symptom management aids in helping a child or youth and their family to have a better quality of life. Ironically, stimulant medications are used to manage ADHD symptoms. These stimulant medications include dextroamphetamine, also known as Dexedrine, guanfacine XR, also known as Intonep XR, lisdexamphetamine, also known as Vyvanase, methylphenidate, also known as Concerta, Bifentin, or Ritalin, and mixed amphetamine salts, also known as Adderall. Other non-stimulant medications are also used to manage ADHD for individuals who do not respond to stimulant medications. These include atomoxetine or Strattera, and clonidine, also known as Catapres or Dixurit. Now, let's focus on the stimulant medication called methylphenidate, also known as the brand name Concerta. Methylphenidate is approved by Health Canada for treating ADHD in adolescents and children ages 6 years and over. Methylphenidate is used to improve the mental and behavioral symptoms of ADHD, which includes short attention span, impulsive behavior, and hyperactivity. Methylphenidate increases the activity of the brain chemicals dopamine and norepinephrine. This activates those areas of the brain that control impulsive actions, attention, and body movements. Concerta comes in tablets that are taken by mouth every day in the morning. Because Concerta is a long-acting drug, which means that each dose's effect will last 10 to 12 hours, it must be taken first thing in the morning. Concerta can become addictive if misused, but if it is taken as prescribed, the chances of developing an addiction are low. Because of the possibility of substance misuse, instruct the clients to use the medication only as prescribed, and they should not allow anyone else to use it. Here are the common side effects of Concerta and some tips on how to manage them. For loss of appetite or weight loss, take the medication with breakfast, drink a smoothie or high-protein drink or boost at lunch, and have a major meal when the medication wears off. For trouble sleeping, try taking the daily dose at an earlier time. Start a bedtime routine or talk to the doctor or pharmacist about other medications that can be used as sleep aid. Nausea, vomiting, and stomach aches are often signs of hunger. Try to eat to relieve these symptoms. For stuffy nose, try using a saline nasal spray. If fast heart rate occurs, tell the clients to discuss this with their doctor. For irritability, agitation, energized feelings, and nervousness, avoid caffeine from colas, coffee, or tea. For dry mouth, try increasing fluid intake or chewing sugarless gum or sucking on hard sugar-free candies. Headaches usually decreases after using medication for 1 to 3 weeks. This may also be a sign of hunger. Try eating or drinking to relieve the headache. If it persists, try using a pain-relieving medication such as plain Tylenol. Potentially serious but uncommon side effects can also occur. If any of the following is observed, seek medical attention immediately. Skin rash, persistent head throbbing, psychiatric effects such as agitation, prolonged sadness, seeing, hearing, or feeling things that are not there, or other unusual changes in mood. Appearance or worsening of vocal or motor tics such as shrugging, blinking, head turning, muscle twitches, and throat clearing. Delay in growth, and painful and prolonged erections of the penis called priapism. If the client develops priapism, seek medical help right away, as this may cause lasting damage. Concerta should be cautiously used in kids and youth who are at a higher risk for heart problems, like in children with pre-existing heart conditions, heart defects, or who undergo strenuous exercise. Now, let's talk about naloxone or Narcan. Naloxone is an opioid antagonist, which means that it blocks the effects of opioid drugs like heroin, fentanyl, oxycodone, and hydrocodone. Other examples of opioid-containing medications are Tylenol 3s, Octosets, and Percocets. Naloxone or Narcan is available as nasal spray or injections. Naloxone temporarily reverses the effects of opioid overdoses while waiting for emergency response to arrive. It restores normal breathing on a person whose breathing has shallowed or stopped because of an opioid overdose. If a child or youth is experiencing intentional or unintentional opioid overdose, naloxone is safe to give regardless of their age. Here's a video to help you understand how naloxone works during an opioid overdose.
People are dying every day from opioid overdose. Parents and children, friends and neighbors. But naloxone can help. Naloxone is a safe and effective rescue medication that reverses the effects of opioids and saves lives. To understand how naloxone can stop and reverse the effects of an opioid overdose, it's helpful to see how opioids work in the body. Opioids are agonists. This means they bind to and activate specific receptors in the body, including the brain, brainstem, and spinal cord. When these receptors are activated, people experience the effects produced by opioids, such as pain relief, euphoria, calmness, relaxation, and slowed breathing. Taking too many opioids causes so many receptors to fill and activate that breathing may become dangerously slow and even stop. This is how an opioid overdose happens, and this is where naloxone can help. Naloxone has a strong affinity to opioid receptors, more so than most prescription opioids and heroin. But unlike opioids, naloxone is an antagonist. This means it attaches to opioid receptors without activating them. So when naloxone is administered during an overdose, it knocks the opioids responsible out of the way and allows breathing to normalize. Naloxone can be administered through an injection or a nasal spray. It usually starts working within a few minutes and lasts from 30 to 90 minutes. While one dose of naloxone can reverse an overdose, sometimes multiple doses are needed, especially in cases involving extremely potent opioids like fentanyl, or opioids that stay in the body longer than naloxone. Naloxone is very safe in single or multiple doses. It may produce withdrawal symptoms in people with opioid dependence, but it has no abuse potential and cannot cause an overdose. It's important to remember that naloxone is opioid-specific. It has no effect on an overdose caused solely by non-opioid substances like benzodiazepines or alcohol. At the same time, people shouldn't be afraid to use naloxone when the cause of an overdose is unknown. If opioids were not involved in an overdose, it won't cause any harm. If opioids were involved, naloxone can save a life.
Finally, let's talk about the allergy medication called epinephrine or EpiPen. Epinephrine is a medication that helps in reversing the symptoms of a severe, life-threatening allergic reaction called anaphylaxis. EpiPen.ca is a reliable website that offers more information about allergy management and using EpiPen. Here is one of their videos explaining when to use an EpiPen.
When to use the EpiPen autoinjector. In the event of a severe allergic reaction, every second counts. Anyone who has been prescribed EpiPen should carry it with them at all times and use it as soon as symptoms of a severe allergic reaction begin. Severe allergic reactions can happen when allergy triggers from sources such as peanuts, shellfish, insect venom, medicine, or latex enter the body. To protect itself from these allergens, the body releases chemicals. In severe cases, this overreaction can be life-threatening. Severe allergic reactions can affect one or more parts of the body, such as the skin, upper respiratory system, or the mouth and nose, lower respiratory system, or the lungs, gastrointestinal system, or gut, which includes the stomach and intestines, cardiovascular system, or the heart and blood vessels. There may be warning signs or symptoms in these areas during a severe allergic reaction. The most common symptoms are swelling and hives. Typical symptoms include swelling around the eyes, hives, flushing, itching, redness or paleness, swelling of the lips or tongue, metallic taste, or itching. Swelling, itching, or difficulty swallowing, difficulty breathing, wheeze or cough, cramps, nausea, vomiting, or diarrhea, increased heart rate, decreased blood pressure, chest pain, or irregular heartbeat, sudden feeling of weakness, feeling faint, anxiety, or an overwhelming sense of doom, collapse, or loss of consciousness. A severe allergic reaction can occur with many or only a few symptoms, and each reaction can be different. For instance, people with asthma are more likely to experience severe breathing problems during an allergic reaction. But for anyone who's been prescribed EpiPen, the first thing to do during a severe allergic reaction is always the same. Reach for EpiPen and use it immediately at the first sign of symptoms. Using epinephrine, the medicine in EpiPen, immediately after exposure to an allergy trigger can help reverse the symptoms of a severe allergic reaction and could help save a life. Remember, antihistamines have not been proven to stop a severe allergic reaction and should not be used before EpiPen. Since no one can predict how bad a reaction will be, and because a severe allergic reaction can get worse very quickly, don't wait for a paramedic or emergency personnel to inject EpiPen. However, using epinephrine doesn't replace getting medical care or going to the hospital. After using EpiPen, call 911 right away or go to an emergency room immediately. Because another severe allergic reaction could happen, stay close to a healthcare facility or where you can call 911 for the next 48 hours. If you or your child do not feel better or get worse, you can inject another dose of EpiPen or EpiPen Jr. 5 to 15 minutes after the first injection. That's why it's best to have more than one EpiPen autoinjector handy. Do not inject more than 2 injections right after each other. Severe allergic reactions can be unpredictable. There might only be 1 or 2 warning signs before a serious reaction happens. Hesitating to use epinephrine, the medicine in EpiPen, after the first sign of an allergic reaction or not using it at all can be life-threatening. If you're unsure whether or not a severe allergic reaction is occurring, it's generally better to use EpiPen. If someone who has severe allergies and asthma is having an asthma attack, but you're uncertain whether it's an asthma attack or a severe allergic reaction, Use EpiPen first. After using epinephrine, follow medical instructions for controlling asthma. As in other cases, after using EpiPen, be sure to get medical care or go to the emergency room immediately. Remember that in the event of an allergic emergency, every second counts. Always have easy access to an EpiPen autoinjector and be sure to use it at the first signs of a severe allergic reaction. To find out more about severe allergic reactions and EpiPen, talk to a doctor or pharmacist or visit epipen.ca.
Resource materials are also provided for your review. To find more information about the medications discussed in this video, please review the handouts provided or visit the websites listed at the end.